I'll let you introduce to gastrointestinal infections. Now you have already read about what is the gastrointestinal tract. The gastrointestinal tract basically begins from the mouth and finishes to the anus. So technically speaking, gastrointestinal infections would mean any sort of infections from mouth to anus in very simple terms. Now why these are important? Because if we look at either in developed countries or underdeveloped countries, still gastrointestinal infections are one of the leading causes of morbidity and mortality in the world. Not only in the underdeveloped countries, but also in the developed countries. Furthermore, as the healthcare systems are improving day by day, we are exposed to challenges, especially with the people with altered immune system or immune compromised patients. Next, a very important consequence that you should remember. Many years back, few diseases were exclusively found in certain geographical locations. But in today's age of international travel, these diseases are not only restricted to a particular area. So, one disease can easily spread from one area, from one continent to the other continent. And finally, we are obviously in a changing paradigm of infectious diseases. More and more infectious organisms, especially the viruses, have been identified, isolated, and attributed to various sorts of diseases. Hence, this is very important. Now, coming back to the gastrointestinal tract, if you are aware about the normal microbial flora, you should be aware that perhaps the largest organ which is associated with microorganisms are the GI tract. All areas of the GI tract, from mouth to the anus, have some sort of microbial flora. And this microbial flora is not just an association with the human body, but rather a symbiosis between human beings and microorganisms. They contribute to many beneficial effects to the human body, not only the physiological needs or say trace elements like vitamins and absorption of various nutrients, but they also regulate many kind of axes which has been named, for example, the gut-brain axis, the gut-brain endocrine axis. And if you look and go through all the axes, one thing can be attributed: any alteration of the normal microbial flora of the gastrointestinal tract will actually impede the normal physiology of the human beings. Furthermore, if we look at the various types of microorganisms which are commonly seen, that's a varied type of organisms. It differs from the microorganisms of the mouth, then the scenario changes in the stomach, the intestines, the large intestine, and even in the rectum. So each and every area has a particular set of microorganisms and they have a particular role to play in the normal human physiology. Now again, if we have to look at the gastrointestinal tract infections, we can easily divide them into two parts. One is called as the upper tract and the lower tract. Anatomically speaking, obviously the oral cavity, esophagus and the stomach, if any infections occur there, we call it as upper GI infections. And any infections beyond that, we call it as lower GI infections. Now this is important because if we look at the microbial flora, the anaerobic bacteria are more in the guts, that is the small and large intestine, colon and rectum. However, there are some anaerobes which are also present in the oral cavity. I'll come to that. Now, what are the kinds of infections that we can see? Let us start from the mouth. The first thing that we can see is inflammation or infection in the oral mucosa. Okay, that is called as the oral mucositis. Very commonly seen, especially in patients with undergoing chemotherapy or radiation therapy. Then, after the oral cavity, we can find various infections. For example, dental infections like periodontitis, gingivitis. These are also caused by microorganisms. Similarly, pharyngitis, especially the oropharynx, can all be affected. Next comes the esophagus. Very common organism that we can see is the Candida, which causes the esophageal candidiasis, and other organisms can also cause esophagitis. Coming to stomach, that is called as gastritis. A very common organism which causes gastritis is, have you heard about it? An organism called as Helicobacter pylori or H. pylori. Moving on to the colon, we call it as enterocolitis. Entero obviously means enterus and colon colitis. Now this is a mixed infection most of the time, and if it is uncontrolled, it can lead to what is called as necrotizing enterocolitis. Furthermore, in the lower GI tract, that is the intestine, other varied manifestation can be seen, that is when the absorption of the water and food is altered. If there is only alteration of the absorption or secretion is there, we do encounter what is called as diarrhea or passage of 3 or more stool per day with change in consistency. That is what we call as diarrhea. That can be present in an acute form or a chronic form. Now, if there is an ongoing inflammatory condition that is going inside the intestine, it may be associated with inflammation, like signs of fever, increased mucus secretion, presence of pus and blood in the stool. That is called as dysentery. Moving on, coming to the last part, we can see what is called as proctitis or inflammation of the perianal region. So this is a gross overview of the various kind of infections. However, there are many other types of manifestations also. For example, the graft versus host disease. Now, what is a graft versus host disease? Any idea? So these are the diseases which can be seen after an organ is transplanted into the patient. So the recipient may, over here it is called as graft versus host disease. The donated organ will lead to immune stimulation, and which may lead to many kind of diseases. And in those patients also, we can see some effect on the gut. For a very commonly seen in patients undergoing hematopoietic stem cell transplant. Finally, as you can see, there are many type of opportunistic organisms which can cause GI infections. Now, what are these organisms? I have already told you. These are the organisms which generally do not cause infections in immune competent adults. However, in immune compromised patients or patients which are hospitalized, undergoing many kinds of therapy like chemotherapy, radiotherapy or steroid therapy, many organisms from fungus like Candida or viruses like CMV can cause infections anywhere in the GI. So these are the more or less a gross picture of the various infections which are seen in the GI tract. Now, if we need to categorize these infections, we can categorize into many parts. First is based on the organisms. The organisms which cause infections, they can be classified into either exogenous or endogenous. Now, as the name suggests, exogenous means an organism which was not previously present within the human body but rather acquired. Now, when we are talking about GI infections, most common route of acquiring an exogenous organism is through ingestion. Next comes as the endogenous organisms. What are these endogenous organisms? As the name suggests, they were already present within the human body. Now, these organisms, if there is any alteration in the normal physiology of the gut, they can cause infections. Those are called as endogenous infections. Okay. A very common example would be, for example, appendicitis. Very common. So, if there is any alteration in the physiology of the intestinal appendix, what will happen? There will be inflammation, and on that inflamed area, the microorganisms, those are already present in the gut, they can cause infection. Moving on, again, the organisms causing the disease can also be divided based on how they are causing the disease. For example, the first type, which we can call as dysbiosis. Now, what is dysbiosis? Suppose there is alteration of the microbial flora. This alteration can be because of many factors. The most common factor that we do encounter is giving the patient a broad spectrum antibiotics. These antibiotics will not only have an effect on the organism causing the local infection, but will also have the effect on the organisms that are already present in the gut. That is, the residual flow of the gut will also be altered. So one part of the organisms may be killed, the other part will not be killed. What will happen? The other part will overgrow. This is called as dysbiosis. For example, I will give you an example. In the gut, a fungus called Candida is present. Now, if you give a patient with broad spectrum antibiotics, what will happen? Most of the bacteria will be killed. And these bacteria actually restricts the growth of the Candida. When the bacteria are killed, what will happen? The Candida will overgrow. And this may lead to various kinds of manifestation. That is called as dysbiosis. The next type, what we can see, is called as infection. Now, when we call it as infection, this infection may be either local or may be systemic. Now, this is the most common type of infections we see or we read, where the organism is acquired by ingestion, and their effect may be local. That means either on the intestine or may be systemic. For example, in case of enteric fever, the infection starts locally and then it is able to penetrate from the gut into the systemic circulation, causing systemic diseases. Okay. Now, these organisms, obviously, we can again categorize the organisms into various types, like a bacteria or a fungus or a virus or parasites. The third type, what we can see, is called as infestations. Now, this is not infection, that is infestations. Now, this word is commonly associated with worms, or we call it as helminths. So, any kind of parasitic helminths which when a person is affected, we call it as parasitic infestations. It could be a roundworm, it could be a threadworm, and it will also depend on the site of the infection. For example, in case of enterobius or pinworm, the site of the infection is cecum and rectum. In case of roundworms, it will be in the small intestines. Okay. So that is called as infestation. And finally, we can call something called as intoxications. Now, what is intoxication? Or very colloquially called as food poisoning. What happens over there? Food means not only food, it can also be acquired by ingestion of fluids also, including water. Now, what happens over there? The organism is already present in the food, or the organism has already produced toxin in the food or the fluids. So, when a person ingests the fluid or the food, these preformed toxins are absorbed to the gut and it will lead to manifestations. That is called intoxication or food poisoning. Just a point of differentiation that you should know, that in infections, mainly bacteria and viruses, they also produce certain toxins, but those are not part of food poisoning. Why? Because in those, the organism first is, what happens? After the person acquired the organism will adhere, it will grow, colonize and produce the toxin right inside the intestine or the gut itself. That is locally produced toxin. That comes in the part of the pathogenesis of these organisms. Okay. But in case of food poisoning, the toxins are already present. The organism may not be present. Okay. A very common example is a staphylococcal food poisoning. So, suppose the food already has staphylococcus, it has already produced the toxin, you even have heated the food. Heating would kill the staphylococci, but it will not degrade the toxin. So, if you take the food, obviously you will have food poisoning. So, chiefly we can differentiate between these four types. Okay. Next. Now, let us look at the various organisms which can cause various infections. For example, Salmonella, Campylobacter, Shigella, these are not present within the gut of a normal human being. That means they are acquired. The infection can be locally in case of non-typhoidal Salmonella, or could be systemic infection like enteric fever in case of Salmonella typhi or paratyphi. Similarly, Campylobacter can lead to watery diarrhea local manifestations, and some sequelae like GB syndrome can occur in the aftermath of the disease. Shigella generally presents with dysentery, that is with pus and blood. Similarly, many enteric organisms like E. coli may cause various types of manifestations including diarrhea, and obviously I think you have noted the most common type of diarrhea is called as the traveler's diarrhea, is caused by one particular type of Escherichia coli. Similarly, in the hospital setup, we can also encounter various infections like, for example, Clostridium or Clostridioides difficile. What is this? Whenever a patient is admitted in the hospital and is receiving broad spectrum antibiotics, first what happens is dysbiosis of the normal microbial flora in the gut. Spores of C. difficile is acquired with food, and these spores start to proliferate within the gut itself. After the proliferation, it will produce C. difficile toxin, and this toxin will lead to diarrhea and causing pseudomembranous colitis. Similarly, if we look at the fungal infection, the most common fungal infection is Candida species. However, other fungus like Cryptococcus, Aspergillus, these can also occur, but these are more commonly seen as an opportunistic infections. Coming to viral infections, community acquired viral infections are very common, especially that is seen with rotaviral diarrhea in children or norovirus infection in adults. Other than that, we can also encounter other infections like cytomegalovirus, especially in immune compromised patients. HIV and herpes virus, they can also cause gastrointestinal diseases. Now coming to parasites, again we can divide the parasites into two types. One of the protozoas and the helminths or the worms. The protozoas can cause diarrhea. For example, very commonly you can see that is the giardia, which causes giardiasis, or Entamoeba histolytica, which can cause entamoebiasis. Furthermore, very commonly seen, especially in HIV patients, that is the coccidian parasitical infections with Cryptosporidium, Cyclospora and Cystoisospora. And next comes are the helminths. I have already told you helminthic infections are more commonly called as infestations. Helminths could be, for example, the roundworms, the hookworms, the pinworms, the threadworms, etc. Now please look at this picture. This picture shows what type of organisms actually infect or causes disease in the GI tract along with the degree of immune suppression. If we look over here closely, in case of advanced immune suppression, for example, a patient in the stage of AIDS or acquired immune deficiency stage, we can find almost all of the bacteria, the common bacteria, the fungus, the parasites can cause infection along with the viruses and the opportunist diseases. But if we go down the level of immune suppression, we can find predominantly some of the bacteria and the viruses cause infections. Okay. Now, how to approach a patient clinically? This is very important. Now, we can approach the patient in this sort of manner. Some manifestations over here, some over here. For example, the patient, based on the complaint, may complain of passing stool with or without blood and mucus. If the patient is complaining of repeated passage of stool, especially with a change of consistency, we can categorize the patient as a diarrhea, and if it is present with blood and mucus, we can call it as dysentery. Similarly, based on the travel history or the kind of history the patient present, we can also easily categorize whether the patient is having a traveler's diarrhea or not. Again, we can also categorize the patient based on the duration of the disease in case of diarrhea. If it is less than 2 weeks, we call it as acute diarrhea, and if it is more than 14 days, we can call it as chronic or persistent diarrhea. Next, non-specific inflammation of the gastrointestinal tract can be seen, we call it as gastroenteritis, or there could be signs and symptoms of food poisoning. Other than that, the other type of infections that can be seen, for example, in hospitalized patient, we can see either necrotizing enterocolitis or enteritis based on the location, or a pseudomembranous enterocolitis seen with C. difficile, or we can have a tropical sprue or peptic ulcer disease What is a peptic ulcer disease? It is the ulcerative disease of the stomach, caused by Helicobacter pylori. And other infections that would include appendicitis, diverticulitis, and typhlitis. Now, thing with these other infections are most of them are polymicrobial infections. All are of endogenous origins. So, this is how we can differentiate to approach the patient. So, let us go through this pretty quickly. I have already told you what diarrhea is. Okay. Now, let us look at the causes of acute infectious diarrhea. So, infectious diarrhea can be inflammatory, can be non-inflammatory. If we look at the non-inflammatory causes, very commonly we see rotavirus and norovirus in case of children and adults respectively. In case of protozoa, commonly we can see giardiasis and coccidian parasites. These are non-inflammatory. In case of inflammatory diarrhea, cytomegalovirus causes inflammatory diarrhea and Entamoeba histolytica is the protozoa which causes inflammatory diarrhea. Coming to bacterial causes, so in non-inflammatory diarrhea we can find mainly toxin based, either preformed toxin or toxin producing bacteria like Enterotoxigenic E. coli, Vibrio cholerae which produces the cholera toxin, or in case of inflammatory diarrhea we can find organism which causes inflammation either by producing local cytotoxin. Cytotoxin means a toxin which directly affects the cells, or mucosal invasions. Cytotoxins can be seen in enterohemorrhagic E. coli. In case of mucosal invasion, we can see in Shigella, Campylobacter, Salmonella, etc. Now, if the diarrhea is more than 14 days, we call it as chronic diarrhea. Commonly, chronic diarrhea is generally associated with patient with altered immune status, and most commonly we can find parasites like the coccidian parasites or chronic Entamoeba giardiasis, or in case of bacteria we can find C. difficile, Plesiomonas or Campylobacter, and some of the viruses like CMV can cause chronic diarrhea. Now, all these are important. The first, you must categorize the patient whether the disease is community acquired or nosocomially acquired. Now, if the patient is coming from the community, most probably the causative agent would be acquired from the community. That is, if it is a child, you can think of a rotavirus. In case of adult, we can think of a norovirus, or the patient has a history of travel, that is the traveler's diarrhea, etc. and etc. Or it could be even because of a Shigella dysentery or even salmonellosis. But if the patient is nosocomial, that means the patient is already admitted in the hospital or has a history of or a recent history of stay in the hospital, then we can include other differentials including C. difficile and other hospitally acquired infections. Now, what investigation that we can do to determine GI infections? Before going to the investigation, what could be the clinical signs and symptoms? So, predominantly the clinical signs and symptoms will depend on the site of the infection. Okay. For example, if the patient has a oral mucositis, what will be the common complaint? It is difficult to eat food or intolerance to all spices, difficult to drink water. In case of esophagitis, it will be difficult to swallow liquids and solid both. In case of, if there is gastritis, what will be the signs and symptoms? Upper abdominal pain, easy feeling. That means even after taking a small amount of food, the patient will complain there is pain in the upper abdomen. Similarly, in case of duodenal ulcer, there will be pain again in the upper abdomen. There might be vomiting, etc. and etc. So, signs and symptoms will basically depend on the site of the infection. It could range from systemic symptoms like fever, nausea, vomiting, pain either in the upper abdomen, middle part of the abdomen, or in the flanks also. Next, what we need to find is if there is any sort of change in the consistency of the stool. It could be diarrhea, dysentery, whatever it may be, that should be noted. And examination of the stool is very, very important. So, What do you need to look in examination of the stool? First is whether there are pus or WBCs or not, and whether there are blood present. It could be present in small amounts, we call it occult blood, or it could be frank blood. And we can also look for the various cysts of various protozoa or eggs of the various helminthic organisms. If the cause is bacterial cause, we can also send the stool for culture, and in case of viruses, we can also look for presence of antigens, or we can also go for molecular test for detection of the organism. Now again, the pathogenesis I've already told you, it is very simple. The first is acquiring the organism, then it will be the adherence. Some organisms may adhere to the mucosal surfaces, some may adhere on the intestinal epithelium. For example, in case of mucosal adherence, there is commonly the E. coli, the coccidian parasites, and the viruses like rotavirus and the norovirus. Whereas organisms predominantly causing inflammatory disease will end up invading the intestinal epithelium. Some organisms will produce toxins like enterotoxins, either the cholera toxin or the toxins produced by E. coli. It could be a labile toxin or a verocytotoxin. Shigella and preformed toxins like Staphylococcus or Clostridium botulinum. Now, which people are more prone to get infected? Some predisposing factor does affect. The predisposing would include suppression of normal flora. The most common reason of suppression of normal flora will be use of systemic antibiotics. Neutralization of gastric acidity. This is very commonly seen in the people taking up especially the proton pump inhibitors for a prolonged period of time, sometimes even without a prescription of the physician. So prolonged intake of PPI can lead to reduction of the gastric acidity. Always remember, gastric acidity is one of the part of the innate immune system which protects the body, especially the gastrointestinal tract, from organisms. So if a patient is on PPI for a pretty prolonged period of time, these people are more prone to getting infections leading to GI infections. Inhibition of the intestinal motility. Again, if you observe, many people are taking up antacids along with anti-motility agents also. Sometimes even the patient may have undergone various kinds of surgery, especially in the gut, which leads to alteration of the intestinal and gastric motility. So these people are again more prone for infections. Next comes the age and the location. Obviously, extremes of age, the children or infants and elderly patients are more prone for infections. And coming to location, obviously where the patient is. I've already told you, we can differentiate between whether the disease is acquired from the community or from the hospital. Next, a very important is antibiotic associated diarrhea. Always remember, whenever systemic antibiotics is given, there might be diarrhea, that is predominantly because of the dysbiosis, that is called as antibiotic associated diarrhea. And when in that patient, Clostridium difficile organism grows and produces the toxin, we call it as C. difficile associated diarrhea. In case of stool, I think this has already been discussed in your group discussion classes. In stool, we go for the microscopic examination, and then we can also go for this is a picture of pus present in the stool. Then we can also go for culture, etc. and etc. This is a picture showing the cyst and the propozoid form of entamoeba. In direct stool, various organisms can be seen in for example, in this E. coli, you can see a sluggish motility, although the bacteria are motile very sluggishly, whereas over here, if you can see, the bacteria are moving very fast. This is the active motile, and over here, if you can see, it looks as if like a leaf is falling from the falling from the tree. That is what is seen in case of giardiasis, and over you can see a movement of the entamoeba with the help of a pseudopodia. Okay, so after the microscopic and the macroscopic examination, we can go for the bacterial culture or we can go for the tissue culture, and if the culture is not possible, we can go for antigen detection and detection of the nuclear elements like molecular test. Recently, and not recently, for a pretty long period of time, there is another kind of a test that is called as the BioFire FilmArray. Now, what BioFire FilmArray is? Normally, when we look for a nucleic acid amplification test, we generally test for one particular organism, be it a bacteria or a virus or whatever it may be. But in case of BioFire, what is done is we look for or we test for a panel of microorganisms or the common organisms which causes GI infections, and we run the test simultaneously. So it is quite easy to diagnose with the help of a BioFire. Now, coming to management. First things first, you have to understand what is the etiology of the infection. Not all infections has to be treated with antibiotics. Okay. Let us look at the pathogenesis. Now, if we look at all these things, just think, if you logically think it out, where do you need to prescribe antibiotics? What is the cause of dysbiosis? That is alteration of the flora. It could be caused because of the patient is already getting some kind of antimicrobial agent, or the patient is already having a disease that is not related with the GI tract, or the patient is having an altered nutrition. So, if you remove all these causes, most probably the microbial flora will revert back to what was previously. So, we do not need any kind of antibiotic therapy over here. Similarly, if we look at intoxications, that is the poisonings, do we need antibiotics over here? No. So, we need to treat for the presence of toxin. Okay. So, we don't need antibiotics over here. Now, in case of infections, now we have to look at if it is a local infection. Most of the time, antibiotic is not required until and unless there is presence of signs of inflammation. That is pain abdomen, tenesmus, clinically, and blood in stool. Then we may give antibiotics. Otherwise, in case of only diarrhea, whatever may be the cause, a bacterial or a viral, most of the time the patient will improve, and the main modality of therapy would be rehydration. Rehydration means not only fluid replacement but also replacement of electrolytes. Okay. Now, so as far as the Stanford guideline, we can categorize the patient, what kind of diarrhea the patient is having, mild diarrhea, moderate diarrhea, and severe diarrhea, based on which the replacement can be done. Now, in case of that is intoxications or the food poisoning, based on the history, we can divide what is the history, then after ingestion of the food, what is the time duration of the onset of symptoms. If the onset of symptoms is between 1 to 6 hours, most probably it is because of either Staphylococcus or Bacillus cereus. If the onset is between 8 to 16 hours, probably it is because of the Clostridium or Bacillus cereus. And if it is more than 16 hours, the organisms could include like Vibrio, E. coli, or Salmonella or Shigella. So, this history will help us in determining what could be the possible cause of food poisoning. Now, coming to infections, if there is signs of inflammation, there is a probability that this could lead to a systemic infection. So, in that case, antibiotics are required. Or if the patient is debilitated, the patient is at an extreme of age group, either an infant or elderly, or the patient is immune compromised, then we may have to give antibiotics. Next, coming to infestations. Infestations mean worms. Now, in case of parasites or helminths, that is the worms, we have to give antiparasitic drugs. Otherwise, those organisms, that the parasites, will remain inside the human body and may lead to many aftermaths. For example, it may lead to malabsorptions, and this may lead to many complications, especially in children, or it can cause surgical complications like obstruction of the gut. These can be seen in case of infestations. Okay. And the last part that I want to discuss is called as fecal transplantation. Now, if you do remember, right at the initiation of the lecture, I have told you the important role that the normal microbiota plays in the human physiology, human gut physiology. In the aftermath of any or all kind of these diseases, one thing is very eminent, that there is persistence of dysbiosis. Most of the time, normal microbiota is restored, but in many cases it may not be restored, and this will lead to various kinds of manifestations, that is other systemic manifestations. It could be autoimmune manifestation, it could be gut neural manifestations. I'm not going to discuss all those things. The treatment alternative in these patients is replacement of the gut flora. How it is done? Basically, stool is collected from a healthy person. The microorganisms present in the normal stool of this healthy person are isolated, and these microorganisms are then gave in a pill formation to the patient. These microorganisms will then go into the gut, in the intestine, they will proliferate and will restore the normal microbiome. This is called as fecal microbiota transplantation. Okay. So that would be the end of today's lecture. So that this is what we have covered.